Morning. You're listening to Community Heartbeat presented by Outreach Community Health Centers. Not just a show, this is a movement dedicated to keeping or bringing our community together through wellness, keeping your heart pumping with positivity. Happy Friday. I'm Ebony Ssali. Happy, how y'all
How are
feeling?
you doing?
Listen. Good morning.
I'm loving the glasses, girl.
I
You
mean,
rocking them?
listen, it's giving. Let me check the stream. Y'all get up, get on the stream. Get
Yeah,
up, good morning, and get on the stream. Cause this is all for you. This lipstick is for the people. How y'all feeling this morning?
I'm
It's still
good.
early.
Got a lot of rest last night.
Okay.
Of course, being a avid Brewer fan, I'm not feeling too good about that.
You gotta win some and you gotta lose some.
Yeah, but the ones you're supposed to win, you got to win
Well,
if you want to
that
get
is a
there.
champion mind state.
Yeah, you got to win the ones you're supposed to win. And again, if you really look at it, I mean, they did what they were supposed to do. That being the Cubs. When I say they, you take care of home court. So they handled their home court. We handled ours. So now we're back at home, and if we handle ours, we'll move on. If
When
we
is
don't,
the next game? Okay.
yeah,
So you got your tickets, you got your
right.
situation.
But overall, you didn't ask all of that. But I'm good.
Listen, it's about experiences. I feel like these last 2 weeks have been about experiences. Last night I was at Black Violin, so shout out to the station. Them boys, every time they're gonna give you a show. Every time they're gonna give
Clark
you a show.
Kent call it something else. What did he call it?
You're not gonna treat my people like that in here today. Don't let them treat you like that in here today. Don't. I got you on this one. We good.
I'm not going to repeat
not on
what
my
he said.
Not on my watch.
But I tell you what would be good right about now.
What would be good right about
some whips. Some whips.
Wascally Wabbits. Listen.
Some whips would be good right about now.
The Wascally Wabbits are in the building. Laughter is good. Life is good. These past couple weeks, I have been going, I feel like nonstop. Last weekend was the Lakefront Marathon. So that was a moment. My brother ran it. So kudos to the folks that are getting out. I did not run it. Let me be really, really, really clear. I was there with a sign like, do it. Yeah. I was an emotional support human being. But shout out to the people that are getting healthy and working themselves out. Right out. You been in the gym?
Yeah, you know.
Okay, you focus because I'm working on this community fitness, health, and wellness. Okay. We're gonna get the people.
I'm with it for real.
Now I'm gonna be in the back again with the sign.
You went terrible.
As an emotional support human. Just doing the things. And it's a lot going on at Outreach. Listen. First off, let me just say, I got my COVID shot last week. COVID and flu. Got my shots. Right out. I'm not giving up on you. Okay, it's like the mothers who ain't giving up on me.
Oh, that ship sailed.
That
ship sailed.
I'm not giving up on you. I'm not. But it did have me down. Yeah. So I want you to know I thought about you when I was down those couple days. I was like,
I would rather see it on TV than see it in person.
But listen, this is
and I believe you. Like I believe everything you say about it.
This is what pushed me over, right? We're about to go into World War III, right? Like if we watching the signs, you got to be healthy.
Yeah, well, I'll tell you one thing.
You got to be healthy.
It do look like we're about to go into World War 3, 4, 5, and 6.
And if you got the pestilence all up in here, all up and through here, how can you run and make it safely?
Easily, because I just believe that I don't want to be in the war and my arm is sore from the shot.
Right out.
Listen. Was your arm sore?
It was
okay. Then I can't hold my weapon
again. That's the other shoulder. So you got that little piece right there. So you got to nestle it. Listen, again, I am nonviolent, but very protective. Let's be clear. Nonviolence is the way to go. But yeah, I was down till like what? I got that Thursday. I was down to like Sunday morning.
Yeah,
and I was like, right out.
I told you, yeah.
But it's for the betterment of our people. Because people are being nasty again. And I say this on the show. People just coughing with their mouth all open in the public. And then you just look like, did you just
spit in the air?
Disgusting. So, listen.
So how did it make you feel?
Right out, don't start.
No, seriously. I mean, I'm just asking, like, just playing, devil's
Devil's
advocate.
advocate.
Yeah,
Listen,
but some people will actually have that question of, okay, like I'm struggling between getting it, but should I get it, and how will it make you feel, and what's the process?
okay, so I got the flu, and it's been a couple years. I think I was still teaching at the time, like full time. But I got sick so bad. The flu, nose, aches, pains. I couldn't even move.
Oh,
Like,
yeah,
and then you try to go and talk to people.
yeah,
This was before the masks were cool and all that. So it's like no voice.
yeah.
I was down. So if I look at those two, but yeah, a little pain, little swelling afterwards. So I did have to switch my shooting arm to the other arm. Couldn't rest on that. But bright side, folks die from the flu. You still ain't. Y'all help me out. Y'all help me to get right out
It's
in
over.
for his inoculation.
It's over.
414-444-5250. You gotta get in right out.
Listen,
This is my mission now.
I believe
I
you.
didn't care at first, like not that deep, but now
Yeah.
it's my mission.
And you know what? And I believe every word you say. I believe it.
But you're not, okay, so what would it take? What would it take? Or is there literally nothing that can be done to persuade you?
Let me think.
Because this is how I'm coming to those folks on the other side of the aisle. I'm just asking them, is there anything that could make you look at the TV and go, okay, it's time. It's time for this to wrap up.
This is, since we have an honest conversation, I'm going to be honest with you. I think that what has me is, how do we go from, COVID being deadly and everybody got to wrap up and it's out here, and how do we go from that to, okay, it's all right now, and everybody can come out and you don't have to mask. And if COVID was airborne, which I believe it is, how do we get rid of it?
Well, wouldn't you? What I forget the actual words that they used, but it's like, excuse me, like herd, something like that.
Herd immunity.
There you go. So once so many people are vaccinated, it kind of
but what
brings
about the
down
people?
the chances of.
I get it, but what if COVID is still airborne?
Yeah.
And it's passed from people to people, but it's in the air. You can catch it from the air.
Yeah.
So even if the people do have the shot,
right,
COVID is still present in the air.
Yep. But it's making your symptoms. So think of it this way. I use dodgeball as an example. The more people that are involved in the dodgeball game, the less chances you have of getting hit. Right?
Right.
Okay.
Somewhat.
Right?
Yeah.
But if you only have one person in the dodgeball line and you got three of them, right, you will hit that person. So viruses are the same. They get into your body. And some people, I very rarely get sick. But when I do, it's like, oh my gosh, she gonna survive, right? So hand washing, doing all that, I'm reducing my dodgeball opportunity.
But again, how do we go from it's in the air, it's deadly, people are dying.
Yeah.
A lot of people hasn't been vaccinated.
Let me ask you this. You see how storms move?
Right.
We gonna hit you with all the philosophical.
Look at it in that way. When you look at the Doppler radar and all of this stuff, and you can see it moving. So whereas it may start in China, if it's airborne, it's moving. People are traveling, so it's getting in that way, and it moves through the air, what have you. Do you think that air can move out? And
no, because COVID, even if it do move out and it's airborne, it's going to stick to something because it's airborne.
Right.
But it can only live so long on something.
No, there is a certain life that bacteria, viruses have to be out.
But again, if it's airborne, it's not just like it's one piece of COVID.
I don't believe that we're like recycling or the same air is coming back.
No. So
what I'm saying, deeper, though. It gets deeper.
So what I'm saying is, and that that could be possible, but air is in circulation motion. That's how air moves.
Yeah.
So
I don't believe we're sucking in the same air.
No, but what I'm saying is, if COVID has never went away, And if it was deadly then, why isn't it deadly now? Because everybody hasn't taken a shot. And I'm one of them. I know I haven't taken a shot, but I'm not sick with COVID. I haven't caught COVID.
Maybe you
in this period of
have.
time.
You just don't know that you.
Well, no,
do
because
you test regularly?
No, because when I did catch COVID, I know what it felt like.
Okay.
And when I caught it the first time.
So wait a minute, you said you haven't, but then now you're saying
No.
did?
Listen, in 2020, when I caught COVID. I caught COVID, right?
Okay.
So I know how it felt with the breathing. It was hard to breathe.
Did it feel like that?
Oh man, it was terrible. I couldn't sleep.
Tell us more about this, so then we can measure this against the shot.
Right. So it was like the breathing was terrible. I had a hard time breathing, sinuses, and I remember the exact day when I caught it because I felt it. It was like something went up my nose, and I felt it, and I started sniffing, and I'm like, wow, like it was like all of a sudden sinus just went crazy, and so then it went from like my sinuses being clogged up to a headache to it was hard for me to breathe.
So you had the COVID.
So then after when I came out of that, I'm like, wow, okay, that was different. That wasn't an average cold. And you know, coughing and things like that. So after I went through that, I didn't take a shot. I just
Do you ever get the short versions of these stories?
Nah,
I'm just kidding.
No, I ride it till the wheels fall off. Till the wheels fall off. So no, seriously. But you know, man, I went through the process of quarantining myself. I was straight. But then again, COVID was still present.
It's still present now.
It's still exactly,
and it mutates. So that's the thing about it. It mutates. So
right now, that's what I was gonna get to because it can be at a lower state right now, but it's figuring out how to survive itself.
I get that.
So it will build up its own. And then of course then you need a different strand of vaccination to combat the new mutated version.
Listen, man.
Because now I could be wrong, but if
you're wrong,
you know, I pay attention. And I know that
wait, hold on.
COVID's not
you pay
new.
Attention?
Yeah, COVID's not new.
It's not.
No,
COVID.
COVID been around for years.
Right. So 19 was just that
strand.
strand.
That strand. Yeah.
Yeah.
But COVID is in the Lysol bottle.
Oh my
if you turn around and read the back of the ingredients, it's in the no. Read it.
It's one sitting down there. Pull
the
Lysol
bottle.
He got
COVID
it right there.
is not in the
Now it do say COVID on there, but it say
listen.
It do say COVID on there, but don't say it's in the ingredients, Jermaine.
It's not in the ingredients. Okay, let me just before I hold this up on camera, let me just say this is not an endorsement.
Let's not let this be a Trump moment.
Yeah,
either.
this is not an this is not an endorsement or
drink bleach and put fingernail polish on your eyes.
Please consult your physician for medical advice. Let me just say, listen. That's kind of small.
It's a lot of print on that bottle.
I'm gonna read that during the break.
That's why I passed it to you. My eyes ain't no good.
These are a single lens, okay? So I got to zoom in on that thing. But I will do that during the break. But listen, the bacteria, the viruses are always present. All we're doing is reducing the symptoms, reducing the downtime, reducing the implications of it. That's all I'm saying.
And keeping in mind, it's why it was so detrimental to those that had pre-existing conditions, because it broke down the immune system so tough that a lot of the pre-existing conditions they couldn't fight off.
Right.
You know what it was doing to their bodies. Right. So I mean, you know, that's just
it ain't worth it. It's silly. It ain't worth it. Listen, come and get your vaccinations. I'm gonna keep working on Right Out. And the day that you roll your sleeve up and get that vaccination, it's gonna be a proud mama moment.
It won't be for vaccination, it'll be for cooking. The day I'm rolling up my sleeve, I'm in the kitchen.
Okay, so once we figure out how to put it in the food, then I see I gotta go the long way. And I can do that. I definitely can do that.
I put it in the bottle for the baby.
I'll put it on the nug.
Put a message in the bottle, baby.
Put it on the nug. No, but vaccinations for real, it's about that time. What about flu? Okay, so you're not rocking with COVID. I got that. What about the flu shot? Just regular old. You're not that easy.
Robitussin.
I can tell you that I've never taken the flu shot in my life. I spoke with my physician and
it's not working.
He encouraged me to take it. However, he did say to me, that he had to take it because of his profession being in the.
Yes.
But
it is
if it was not mandatory or mandated for him to have that shot, he probably would not take it either.
Really?
That's what he stated to me.
Man.
But
See, maybe it's because I'm a baby when I get sick, right? Because my family doesn't respect the sickness that I get, right?
I typically don't get sick, and that's the thing. So when I do, I'm like you. I'm
down.
Yeah.
Down.
I want everybody to wait on me hand and foot.
Because I do it for them. Listen, my family had a little bell. Oh my God, I'm famished. My soup is warm. May you warm up my soup, please?
Oh no, you're doing too much now.
Right? I'm like, Gina, let me get your own fresh fruits and vegetables. Here's your heated pad. When I go down, they like, so you straight, you good, bet. Here's an extra blanket and just Godspeed. What's for dinner, by the way? I'm like, well, dang, I got one nostril, can't breathe. But they want to know what's for dinner.
But do you know what I found? That when you give it to somebody else, you feel so much better.
Yeah, I listen, and I do. When I get sick, it's usually because I let something slide, or I was out in public and somebody was coughing, and I didn't just nip it in the bud and like chop them in the neck. Which again, I don't, not violence.
Yeah, okay.
But it's just nasty. So protect yourself because people are nasty. Get your vaccinations. I will keep working on Ride Out.
It's over.
Debo, come and get your flu shot. Come and get that. It'll have you down maybe for a day, but that's better than being down for a couple months.
Yeah, but I ain't got time to be
Brown
down.
says here in the chat.
Ain't got time to be down.
Ebony.
Yes.
Romel Brown says here in the chat that flu shots help you and the people around you.
They help you and the people around. And don't you love the people around you?
Well, don't you got the flu shot?
Yes.
Well, then you helping me. God bless you. Thank you. Thank you, brother, for that statement. I appreciate that.
Close the door.
Thank you. I appreciate that.
Lady D said good morning, and Happiness Donuts just shouted out the brew crew.
I'm just
Good
saying.
morning.
Hey, my point exactly. He said it helps the people around you. And because you got the shot and you went through the pain, you had to bear the pain for the people. God bless you. Thank you. I look
there
at
was
you
a
like,
man who wore our pain. Okay.
Hey, are you afraid of needles?
Well, you know what though? Even at my big age, I don't look like I can't be like, yeah, put that in. I'm like,
last time I got hit with a needle, I didn't like it, and
nobody likes it.
And the one thing I don't like is, when you got to draw blood and they try to hit that vein, but then they missing and they keep poking. I told one of the nurses, I said, "You poke me one more time."
Lord have mercy. Lord have mercy. Do you give blood?
Only when I have to.
Okay.
I mean, I'm not volunteering.
I give blood regularly.
Like I might need my blood.
This dude,
right out. People need blood too. Okay, so I'm gonna do just a quick sidebar about blood donation. The mosquitoes try to get it too. I give blood regularly. I found out my blood type it has a special protein that helps people with sickle cell, right?
That's great to hear because I have the trait and my granddaughter has sickle cell. So to hear that you have something special within you that could help someone.
I've been trying to tell them I'm a superhero since day one. And then when they confirmed it, I'm like, wait, what?
Jermaine, Romel Brown said, "You're welcome."
Thank you there, sir. I appreciate you. Because of you.
Yeah, he's had the shot.
Because of you and Ebony, I feel great.
Yeah.
Here you go. Look, they calling to yell at you. They are calling this morning to yell at you. So I'm
Thank you, Doc. I appreciate you. All because of you. You and Ebony went to the cross. Amen. God bless you.
They made the difference.
Yeah, Doc, you went to the cross because of me.
Man. Man. So we'll take the first caller. Greetings and good morning. Welcome to Community Heartbeat. What you got for us this morning?
How are you?
Good morning, my Angela. How are you this morning? How you feeling?
I'm doing all right.
You doing good. I've been checking in on you behind the scenes.
Angela, do you have your radio up? We're getting just a little of an echo.
Okay. That's good enough?
Continue to talk. We'll find out. Go ahead.
Hello?
How you
That's
doing?
much better.
Okay.
How you doing?
Well, I'm somewhat disappointed.
Wait, talk to me, because I done checked in with my people for you now. Talk to me.
So people ain't doing right.
Okay, talk to me about it.
Do us a favor, Angela. You have my number. Let's do this off air.
Okay. Yes, that's what I was going to suggest anyway.
Okay.
But yeah, so yeah, and also she has my number, so she can call me directly.
Yes.
Okay.
Because we do need to talk. But good morning, everyone. How's everyone doing?
Good morning. Listen, I went back and listened to the last episode, and I'm keeping Right Out honest for you. I do want you to know that. Okay, I'm keeping him. I'm making sure ain't no foolishness on my watch. Okay, 7 to 9. That's all I can say.
Mr. Debo.
Making plans to be with us soon.
Oh my God.
Talking softly on the telephone.
Not that one. Listen,
Mr. Debo.
Yes, ma'am.
It is so good to hear your voice.
You too, Angela.
I've been calling in the last couple of days, but you've been maybe out of the office or MIA, something, but you ain't been responding.
He is a man of
I was too busy. Look, I don't want no trouble out of Jermaine. You know how you had to get on him, so I don't want him thinking nothing. You know about me and you.
Hey, quit with them crickets right now. I hear you in the background. Keep it up. Don't make me come up there.
Oh, Lord.
And you know she will.
Lord. And now what you were saying about the next group, never mind. This is a family show.
Right.
But no, I just called to say good morning to everyone. Let you guys know I love you all, and I'm keeping you up in prayer.
Angela, have you had your shots? Have you had your shots? Have you been vaccinated?
Yes, sir, I have been.
See.
Okay, you got your flu shot already?
Yes, sir.
Okay, I'm just checking. We concerned about you.
She is.
I appreciate it. I keep it up.
And Jermaine said, "Thank you." Jermaine said, "Thank you for getting vaccinated because
he did.
You helped him.
He like him healthy."
And I am healthy because I'm the only one who's right. He better not be. He told me, you say he like him healthy. What you mean, Bill?
Hey, Angela, have a good one. We're going to move on to the next caller.
Thank you, Angela.
Thank you, Angela.
Next caller.
And listen, greetings and good morning. Welcome to Community Heartbeat.
Good morning, Ebony.
Good morning. How are you? Look, save my life in here. You can see what it's doing in here, right? Good morning to you.
I saw those race signs. I'm doing well. I saw those race signs your brother participated in, and I just waved at him as well.
Yes. Listen, we tried to split it up so that every couple miles he had somebody there cheering him on.
Encouragement.
Yes.
That's all we can do, Ebony.
Look, I got about 2 blocks in me. I could give you 2 good solid blocks of a sprint, and then I gotta slow it down. Are you a runner?
No, I like to see him though. I love track and field when they show it on NBC.
Yes.
I think I ran way back in middle school, but good for him. My question is, does Outreach have the COVID shots for children? My child is under 12.
Yep.
I got mine in September, but when CVS told me they didn't have anything for the children, and my pediatrician does not have it.
So I know we just got new vaccinations in earlier this week, beginning of this week. So I would say give us a call, and the number is 414-727-6320, and just ask about the age range. I want to say yes, that's my default, but I don't want to give you misinformation. So give them a call, ask that specifically. And then I do know that there's walk-ins. So if they say yes, they can get you in later today. So that's the benefit.
And good, thank you. I will call them. I guess they open up at 8. That's what you told the other guy. They open up at 8 o'clock. Okay.
Yep.
And my question is for Jermaine Rideout.
Jermaine Rideout.
One, you are a grandpa now, right?
I don't speak English.
You got a legacy that you're living for.
Come on here.
And then second, how is it that you give your awesome testimony, believable testimony about how you went in for your PSA, had the cancer, went through surgery with all those other chemicals going through your veins, and you can't get this COVID shot?
Because I'll tell you why.
No, you're contradicting yourself. Just like what you tell us, you don't eat cousins and meat and all that. But then, if they put it out there in that room, you're gonna be the first one in line.
But
how you
went for cancer treatment and believed in God, and thank you for saving my life. I caught it early. I'm gonna share this testimony with the entire city. But then you so against this COVID shot. Make it make sense.
I'll tell you why.
Make it make sense.
Okay, since you want me to make it make sense, I'm gonna make it make sense.
Thank you.
See, what happened is, I believe that since Ebony got her shot,
It's only a 2-hour show. Make it quick.
Right.
Sis, love
y'all. Sometimes you gotta slow this thing down because it be so good. It's like when you have a steak on your plate and it's done well. You gotta take your time. See, in order to eat an elephant, you gotta eat it how? Piece by piece. One bite at a time. No. So sometimes it's good to take your time.
No, I say thank you for that call.
Time.
This is what I'm talking about. No, you went through all of that. You went through all of that. Now it's time to keep yourself healthy.
Yeah.
Just it's a 2 minutes.
That's why I go to the gym. I drink a lot of water.
It's 2 minutes.
And on Saturday, I drink breast oil.
We can do this the easy way. We can do this the hard way. Okay, we can do this the easy way. We can do this the hard way. So it seems like he wants to do it the hard way. So, I just will make that. I will make that happen. We gonna have to do it the hard way. I'm gonna have to throw him in the back of the truck. Okay, Debo. Hey, I might need a little bit of muscle.
Bring, you can. We can set something up where you can do on-site vaccinations.
Right. But I will say this, and just kind of bring this together. I know that there's folks with hesitancy, but the reality is, if all the things that are happening in the community, all the things that are happening around us, the very least that we can do is move forward in a healthy way. And that's just one small piece. So this is my PSA to say, come in, get your vaccination. It's a painless process. You might be down for a day. So like I say, I usually don't slow down. So it was a good day for me to take a quick nap and do that. But it's for all of our health. So do not delay. Give us a call today. Y'all like that? 414-727-6320 is the number to call and schedule your vaccination. So part of that is the preventative part, right? I've been thinking a lot this week about how do we prevent the things that we know can happen? How do we program around the coulda, woulda, shouldas, or what could be? So be preventative. If you know that, like myself, around this time of the year, I get very lazy. My circadian rhythm is off, is what I'll say. So I prefer to rest and nest and kind of chill. So I don't try to do a lot during this particular time of the season. I know that about myself. So the preventative part for me is like, find the things that make me comfortable, get all of my shots, vaccinations, all that, any of my screenings. I go get my teeth cleaned next week. So the dental piece, taking care of yourself for the things that you know can lead to harm, to disease in your body. Eat healthier, right? So I know how my mood gets when, like, even now, we just coming up past 7:30, 7 o'clock, and the sun is just up. I need the sun up at like 5:30. So I know that about myself. So get yourself a little light in your room that wakes you up gently. All of that good stuff. So it's about preventative care. Vaccinations are a part of that. Walk-ins are available at Outreach, 414-727-6320. Some other things that are going on every Tuesday. So I don't know if you watch the news, which I hope that you do every now and then. Pace yourself. But our crew was on, I think it was Tuesday of this week, it was Monday of this week, for their harm reduction program. So for those that might be, I would say, working through addiction, working through substance use, we were on TV for a project that we do every Tuesday. And the first Tuesday of the month at the Daily Bird, we have an organization that partners with Outreach to help people get through drug use, right? So 414-727-6320 is the number to call to get connected. If you know someone, if you're around someone, it's right out there. It's all of us to kind of keep each other healthy. Now, this is also Health Literacy Month. I was at a conference a couple weeks ago and we talked about health literacy. Some of the words, some of the terms, some of the phrases, it gets deep. Like sometimes I read my chart and I'm like, what does this even mean? Right. So we'll get into how to make things more digestible as people, how as patients we can understand what these doctors are talking about. All of that is important, but it starts with you being healthy. It starts with preventative care. Get yourself to the doctor. Get yourself to the doctor. So we're going to take a quick break. I know I'm going to come back. I'm going to yell that right out.
But
y'all going to help
the
me.
doctor.
Y'all going to help me. I appreciate the sister who called in.
Man, yeah, she jumped on my heels.
As she should have.
And you know what? And I really appreciate that.
Because we care.
Because that's going to make me drive straight to there, pull up outside.
It's okay.
And drive off.
Listen, although I am nonviolent, this is all I'm gonna say before we hit this break. We can do this the easy way.
Or we can do it the hard way, man.
And you know the little darts they shoot, right? We gonna make it do what it do. You are listening to Community Heartbeat, presented by Outreach Community Health Center. It's not just a show. This is a movement to get right out healthy. We will be right back.
AURN News.
I'm Ebony McMorris. After 2 years of war and tens of
Welcome back to Community Heartbeat, presented by Outreach Community Health Center. It's not just a show. This is a movement dedicated to bringing our community together through wellness. Keep your heart pumping with positivity. Listen, it's true. Truth is sometimes funny. Truth is sometimes difficult, but the truth is the truth. Now, the truth is vaccinations and immunizations are available at Outreach. Walk-ins available. Come on and do that. Tuesday, harm reduction programming, all day Tuesday, so you can walk in for that. But the first Tuesday of the month, show up at Daily Bird and meet our crew. I will say there is one thing I am excited about. I mentioned just briefly, I get my biannual teeth cleaning next week, and we have an event coming up with the Tooth Fairy. Now, I don't know who knows who that knows who that knows who, but the Tooth Fairy is showing up at Outreach, and I am feeling that. So next month, November 7th, we have an event. We're going to test it out internally with a couple of local schools first, but then we're going to open that up to the public for kids to just get them engaged. I went down the rabbit hole because it's also Dental Hygiene Month. Of all the things that are related to our babies' teeth and our teeth and the diseases that come from not keeping our teeth the way they should be. Now, I joke with my father often because he has a silver tooth, right? Or gold tooth, one of the two. So I'm like, I bet you were bad as a kid, right? Because in my mind, the silver teeth children were just bad, right? Like just bad. But I will say I got the benefit that somewhere along the line, they started making porcelain fillings, right? So they blend in with your teeth. So I'm just at the point where I don't have any more teeth that can get cavities. All of my teeth have been filled with the porcelain filling. So, yeah, I have a great smile, I do believe, but understand that I too had some cavities that had to be filled. Now we are back. But they're putting sealants on the baby's teeth because let's be honest, they're eating the stuff they shouldn't be. They're not brushing twice a day. And so that is ruining their teeth. And I will say two things. The funny piece of this is your teeth, right out. Are you with me? Your teeth are bones that you can see.
Yeah.
Your teeth are bones. Okay. Yeah. So I like to say you can kind of tell how people's bones are. Thriller night. Yeah. Do you see what I'm saying? Yeah. But also, the silver teeth children, I love y'all. I want you to know as you grow into adults, y'all are positive members of society. But let's get these babies used to taking care of their teeth.
Reinforcement.
Yes, we do. And know that that's the only set you get. Yeah. You get one.
Yeah.
You get
one real set.
Listen. That's probably why I didn't fight a lot as a kid, because I was just like, oh, what happens if they knock my tooth out? Like you gotta pick up the tooth
and put it back in your mouth
and run it to safety. Like it's not worth it. But I'm excited about the things that we're doing for the babies. Like I said, the Tooth Fairy's coming by Outreach next month. Some more details on that to come. But I like that. I wish there were events like that. When I was a kid, it was just like the Tooth Fairy didn't stop by a lot. Well, the Tooth Fairy around my neighborhood was like, get a job, you bum.
The Tooth Fairy was getting robbed coming to
the Tooth Fairy was kind of like,
get a job, you bum.
You want $1 per tooth? In this economy? Reaganomics? Yeah, no, you're not.
Get a job, you bum.
Yeah, so I'm like disappointed. But the Tooth Fairy, with all of her things, will be coming to Outreach soon. There's also open enrollment. So listen, it's about to get real, which is why I joked and started the show with we got to be healthy because benefits are about to be cut. And like, if we take a serious note here for a second, as all of these cuts come, I think we're still in a government shutdown, right? Like we haven't opened back up. So as people are losing access to benefits, as people are losing their insurance, I looked at one projection and said, the average family that's paying $400 some a month for their benefits, $2,500 is the projected amount that's going to rise. So just think about what that's doing to budgets. Prices are already high. Rent is too high. Gas is too high, right? And now we're about to put benefits on top of that. So I will say this. it will get muddy. We have folks on the ground that are working through that muddiness. So if you're losing benefits, there's a sliding fee scale. If you just don't know what life is going to be, just pop in, at least ask, at least find out what you would be paying out of pocket, so that you're not going without health care, right? Because it compounds right out. It compounds. Your cold today could be a leg amputation tomorrow, could be, and we don't want that if we can help it.
No, we want that
if we can help it.
Right.
So it's Health Literacy Month as well. In addition to the benefits that people need to be looking into, combing through, making sure you're covered for everything. Understanding what the doctors are saying about your body, right? So the way they notate your account, the way they share information amongst themselves is very formal, is very professional. So understanding what that means for you is important. And we call that health literacy. So it's just the plain talk, how many times to take your medication, what happens if you skip a dose. All of that information is important. So I pulled out just a couple of pieces that I think are important for us in our community to know when it comes to health literacy and understanding what it is. If you do not understand something from your doctor, ask. Do you know how hard that is? Some folks just don't ask. Like, no, sorry, doc. What does that actually mean? They'll take it. No, I understand. I understand. The doctor told you to take your medicine every day before 8:00 before you have a meal. Is that clear? And if that's not clear, you got to ask, right? I know that there's a lot of reasons why people know the authority piece, but this is your body, right? My body, my rules, right? Ask of what it is that they're telling you to do, sharing with you to do. And if you don't understand it, keep on asking. Second piece is to learn and understand. So it's one thing to ask the question, you get an answer back, but understand what it is and understand what the implications are. What happens if you don't take your medication every day? Do you fall out? What happens if you don't take it with food? Do you get lightheaded? All these things you need to be asking. That's part of health literacy. Knowledge, right out. Knowledge is key.
Oh, it's key.
It is the key.
It's half the battle.
Okay. Understanding your prescriptions, right? And again, I'm the person that goes in with my little notebook. So I hope that the information we share on this show, you feel empowered to write down and take that into your physician. But if you have chronic conditions, hypertension, diabetes, all of these things, you need to understand how eating, not eating, what you eat, how often you eat, how all those things play a role, because it all affects your body. And understand it so that you understand it. The other piece, informed patients see, because you're over there sniffling right out.
That's because it's stuffy.
You're over
room.
there.
This room is dusty. It's stuffy.
No, it does not have that effect on anyone else.
Said you dusty.
No, he wasn't referring to me. No,
there's dust mites in here, man.
You and your dusty studio. That's
not at all.
That's what's going on. Got me over here like snuffleupagus.
Let me see if I got some COVID strips in my my bag.
Insinuating that.
Anybody got some Vicks in their purse?
Okay.
Some lots all over there. Drank some of that.
It is. I'm reading. I'm working through.
Spray it up my nose. See what happens.
That's on the back of this thing. But I would say this. Do y'all believe that Vicks has an expiration date?
No, I didn't. I swear it don't. I had a bottle. I don't know how long I had it, but as soon as I opened it, my eyes was watering.
You want to talk about shady. So my daughter turns 21 next month. Y'all pray for me, okay? I need all the elders around the church and all the faiths, all the deities. Y'all pray for me. Turns 21 next month. I have a container of Vicks that I bought 2 years before she was born. So we call this her anti-Vicks, okay? The Vicks Still works.
Strong as a
okay.
fool. It's
I
strong.
open that, throw a little bit under your nose, just open you up if necessary. So I'm gonna say this: Vicks doesn't expire in my book.
Yeah, I don't think it expires at all.
Okay, this is good. I just needed to make sure I wasn't going.
We may want to look at the bottle though, just to see if
it
there is.
says it may have expired in 03.
Yeah, even if it has
03,
like it might have expired in 97, but
does it work?
But if you keep it closed,
so you believe in the expiration dates or best if used by dates?
Okay,
best if used by.
See, now this is why this is related. If it's Vicks, you can rock with that being expired. 21 years.
Yeah, because you ain't eating it, you ain't doing
the
that.
views and opinions expressed on this show do not necessarily reflect that.
Well, we got to live in
the capitalism, but your regular medications do have an expiration date. Yeah. And I would say we also have a drop box for that. So please don't flush your old medications. Don't put those into the sewer system, because the reality is our sewer system is not built to filter that out. So do not flush your meds.
The other part is, doesn't it all go down to Jones Island and then get pushed back into?
This is what I'm saying. So you got you might be drinking somebody's heart medication. Don't throw that. Listen, that's a whole different conspiracy right now. It's a whole different something right there.
Don't give him no ammunition.
Yeah, that's the rest of the show. Right. And now I gotta get called into a meeting. Like, why did the show start talking about water treatment facilities? Right. So regular medication that expires. Please understand the using, the disposal of that. Again, Outreach has a drop box, and we send it to a company that disposes of those, so they don't get back into the water supply. So, medication awareness, understanding what your dosages are, your refill dates, understanding all that, health literacy. Okay, understanding your My Chart, the educational pieces that go along with that. That is also health literacy. Access to information. Listen, I know we love a good WebMD. We love to Google our symptoms. There are times where I'll put in runny nose or allergies, and I'll go from allergies to having, again, a leg amputation. That's how I accelerate things. But understanding from a professional standpoint what that access to information is. And then clear communication. Ask. Do not leave that doctor's office until you are very clear on what you're supposed to do and what you do when you check back in. So in the next hour, we are going to talk about not only health literacy. Somebody bring me some Vicks for Ride Out.
Man, it's dry in this room. I'm telling you.
It's that one nostril. Listen, I do say this. Dry. Whenever I walk in here, my nose does start.
Yeah, it's dry.
I just figure I'm like a puppy. I get excited and then my nose start, like a little puppy. So yeah, it's a little dry in here.
Moist.
Jesus. Debo, it only took us 49 minutes today to get to moist. That is a word we are not sharing on this show.
We're gonna ban that
I know
word.
we should get a buzzer for it. But when we come back, we will talk about, again, health literacy, our event that's coming up in November, and just how to take care of yourself as we go into the fall. You're getting a jump on your New Year's resolutions. Debo, I'll be back over there to talk about your New Year's resolutions for this year.
Is that right?
Yeah. We're gonna make a few. But if you start today, you got 60 days on everybody else before we get the party started. So New Year's resolutions, new year, new you. We're gonna get that cracking, and then just make a list of the things that we need to be doing for ourselves.
I know Outreach is very, 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 very busy in the summer months.
Yeah.
Anything major coming up, like
all the things,
all those fun events that you guys are doing, like
all the things.
Listen, with doctors and all of that stuff.
Stay tuned, Debo. We just set a date. We got a couple doctors on the docket already for 2026. So yeah, the things are happening. So we're gonna talk about the new year, how to prep and present yourself for that when we come back from break, and your New Year's resolution. Right. You are listening to Community Heartbeat, presented by Outreach Community Health Center. It's not just a show. This is a movement. I'm Ebony Ssali, and we will be right back. Welcome back to Community Heartbeat, presented by Outreach Community Health Centers. Not just a show, this is a movement. It's the conversations during the break that just give me all the life of all the things. So we were chatting before the break about Vicks and Vicks Vapor Rub having an expiration date, and I shared that I have Vicks that is like 23 years old, and it's still, it's still, you just open it up and just and put it back, right? So we were saying medicines though do have dates and times and refills, so you do have to be really, really close to that. But as promised, we are now into the second hour of Community Heartbeat, and much like I love to do, I'm not the expert. I'm not. So I like to bring the experts in. So today I have Dr. Rashna Tomar. She is a part of our family medicine residency program at Outreach. So welcome, Dr. Tomar. Let me read quickly your bio. She is a Jersey girl by heart. I love that. Who obtained her medical license from West Virginia School of Osteopathic Medicine. Her being a doctor of osteopathic medicine, her passion for family medicine grew from her wanting to treat patients holistically under the DO philosophy, which is that the mind, body, and spirit are all interconnected. True that. She is very passionate about helping the underserved patient population, having served a rural population in West Virginia and serving in an FQHC in the state. Her love and passion for the underserved patient population led her to Milwaukee, where she tries to provide patient-centered care and works hard to reduce health disparities and provide equal care for all. She uses her calm and nurturing personality to make the patient feel comfortable during the visit and gets to learn more about patients as a whole. Her passion has inspired her to pursue a fellowship in hospice and palliative care medicine, where she hopes to continue her mission of providing holistic care and ease suffering for those who have serious and terminal illnesses. She lives by the model that most of the patient care happens outside of her clinic, and that the hospital and takes her time to get to know what's important to the patient. Outside of medicine, she enjoys traveling, exploring local coffee shops, places to eat. So I know you, my girl. This is what I know. Board games, cooking diverse dishes, spending time with family, and her pet cat. I love it. I love it. Love it. So welcome, Dr. Tomar, to the show. Excited to have you. So the first hour we've been talking about taking care of yourself, preventative medicine, and just getting people comfortable with care. So I love your bio talking about how we keep patients calm enough to ask the questions, to come in and take regular care of themselves. So just as a physician, how do you create that environment where people feel comfortable coming in and asking those questions?
I think it starts from the very minute that the patient enters the room. The biggest thing that I learned in residency is setting an agenda. Like, what is the most important thing for the patient? Okay. And oftentimes, if you haven't had care, you'll have like a laundry list of things that you want to address. And unfortunately, you will often hear that phrase, there's not enough time for this visit, because we're only allocating some time. We want to give importance to what is most important to you. Okay. So being comfortable with talking about some of those things takes some time. Building like that patient doctor relationship is something that we really emphasize, and that's why I feel like having a PCP that you feel like you can rely on, be vulnerable with, is very important.
So establishing that regular care. On the show, we talk often about not waiting until something is wrong, getting out ahead of it. So you mentioned the laundry list of things. When you come in for that first visit, you got a lot going on.
Yeah.
But the concept of medicine is you're doing regular visits, right? So you might take the first chunk of concerns this time. You might take the second chunk, right?
Right.
Is that kind of the process?
Yes.
Okay.
So we work with the patient. So right now, medicine is focused on patient-centered care. Okay. A lot of the times, if we look at the traditional doctor, it was seen as like the doctor knew it all. And I kind of heard what you were talking about before. But now your care is what you want to make out of it. There's no one thing that works for all patients.
That say that part again. There is no one thing.
Yeah,
right?
There's really no one thing that works for all patients, and also based on like how determined are you for taking care of certain things like blood pressure, your cholesterol, like those kind of things. So we work with you to organize your complaints and figure out like what is the most important thing for us to address today. So for somebody, it could be, I want to address my blood pressure that I've been suffering with for a long time. Other people, it's more so, I have a finger cut. What do I do with this? Is this going to get infected? So
right. No, all of that makes it huge. So I would say to the listeners, keep that laundry list, keep a track of your body, your symptoms, what's happening within you, to bring that to your appointment. Let me ask this in terms of family medicine. So we think of family medicine as this umbrella that covers what ages really in family medicine?
Yeah, family medicine is so diverse. It covers from a baby just being born, so a neonate, all the way to geriatric patients. So we know a little bit about everything, and we're able to provide care for various kind of pathologies that somebody might be suffering from. So various kind of illnesses that somebody might be suffering with.
So you got the gamut covered.
Yeah. And if we don't know what to do, we'll refer you out. So.
right. No, and I on this show I do talk a lot about, like, I'll pass by the rooms and you all are kind of looking at the charts and together and working through people's conditions and issues that they might have. So I love that holistic concept of medicine, right? It's not one thing, it's everything. So tell me this, in terms of your team, what are some of the common things people are coming in for now? Like, I know hypertension is always a big thing. Diabetes is always a big thing that we're treating. What are some of the common things you're seeing coming in now?
You mentioned it, hypertension, diabetes, cholesterol, but it's not just limited to that. We often forget, like, behavioral health is a big component of us being able to take care of ourselves. So anxiety and depression, that's another big thing that, your primary care provider, if they're able to treat it, they can. Another thing is substance use, such as tobacco, marijuana usage, alcohol usage. So family medicine is really about getting to know you as a whole, and what can we do outside of just the clinic and the hospital to help you in your local community and take care of yourself.
Listen, it's all interconnected.
It is.
That's the word of the day, is interconnected. How does you mentioned behavioral health, so you have family medicine, you have that primary care, you have behavioral health. How does dental fit into that piece? Like, is there, like, I know it's all interconnected, but how do we integrate dental in there?
So part of your annual visit, we ask you questions about your dental care as well. Are you flossing once a day, brushing twice a day? When was the last time you had a dental cleaning? Because you can have, like, plaque buildup, and that can lead to things like your gums being inflamed, cavities. And a lot of the patients that or another complaint that I commonly see is dental concerns in the clinic. They're worried, like, I'm having tooth pain and I can't eat now because of it. I'm concerned, is there an infection that's going on? So having those regular annual screenings is very important too. And luckily at Outreach, we do work with Ascension Dental Clinic. So you do get all that in one building, which is something I love.
It's and the pharmacy is in there too,
and the behavioral health upstairs.
All connect. So no excuses. 414-727-6320. Walk-ins available if you need that extra care. In terms of your specialty and what you're looking to do, is that palliative care. First, tell us what that is, right? And then how you found that is your niche.
It's been a long journey. So oftentimes when people think about palliative care, they think of the traditional, like, hospice. They combine those two words together. So it's often seen as, somebody has like 6 months or less to live, all about comfort care. But palliative is a lot more than that. I realized in my own clinic, I was providing palliative care all the time.
What is palliative care? You got to tell me what that is.
So it's all about treating patients that have terminal and chronic illnesses. So we provide, like, symptomatic relief. It came from the philosophy of cancer. So a lot of cancer patients were first prescribed or first started like with the palliative care model, but now it encompasses a lot of things like chronic kidney disease, heart failure. It's all about setting an agenda. Like I said, this is what I love about primary care, about patient-centered care. That is pretty much what palliative care is. So we provide symptom management. So if somebody's having a lot of pain because of their cancer treatment, we can get on board and help them out with providing medications that sometimes a lot of other specialties don't feel comfortable being able to prescribe. So opioids, PCA pumps, ketamine, like there's so much research going on into providing those kind of medications for those symptom management that it's now becoming like more and more encompassing in a lot of hospitals.
Because it's like at the end of life care, if you will, the comfort is key. I mean, you know, if we can stop some of that pain from occurring.
But palliative is more than that. It's not about just the end of the life. You can be incorporated into any part of the patient's journey. So it could be very early on where they just got the diagnosis. So we talk about like, okay, what will life look like? What kind of medications do you want to be on? What is important to you? So I've heard from when I did like my palliative care rotations, people are like, traveling is very important to me. And some of the medications that I'm on make me very tired. So just being an advocate for the patient is what's very important to me.
So let me ask you that with that, knowing what the patient outcomes, what patients want for themselves, how do you analyze, utilize medications in different formulations, different methods to give patients what they want? So they don't want to be tired because they do want to travel and see sunsets in different places, right? Do you maybe look at what medications are going to make them comfortable, but also what might give them more energy, or what might, you know, is that part of the study, if you will?
And spirituality is also a very big component, because a lot of people are involved with like local churches, local religion, and we try to figure out like, how does that play a role into your medical care?
I mean, it's all interconnected.
That's how it kind of got started. It was from like the Dio philosophy, where everything's interconnected. And I've been on a long journey of figuring out how to interconnect all those things. And
now, how did you start though? So how did you start this? Like, why did you say that's the kind of medicine I want to practice?
It started, well, you mentioned I'm a Jersey girl, so
I feel like you're a Jersey girl. Like, where did that go? I love it.
Yeah, it started at a local clinic. I was shadowing a family medicine doctor, and he taught me what the DO philosophy was. Part of being a DO is we have different modalities of treating pain. So we use our hands to learn more about the musculoskeletal system as well. So we can do like gentle techniques, like more like massages.
Listen, sign me up.
You're welcome to come. Like you said, we're accepting walk-ins for the DO clinic as well. We do have an OMT clinic.
Right out, you hear that? Get a little rubbing, get a little mind, body, spirit connection with your healer.
I hear it.
No, see, now she's saying she's not gonna hit you with the vaccination. She's gonna rub on it a little bit. Now, if
did
Angela
I say
still
that?
listens, right now,
did I say that?
Not her. Right? Let me be very, very clear.
Did I say that?
And listen, if you listen, I got you. Make sure she gonna come into your appointment with you. Just so you know.
There you go.
We have a fantastic caller who she got to keep her thumb on this one. So we love to see that. So it's the healing, it's the touch, it's mind, body, spirit connection, and then adding medicine into that is the field. So what do you think is the biggest difference between? Is it a cultural thing? Is it a social piece? What do you think is the biggest difference between traditional medicine and the DO philosophy of medicine?
The biggest difference is, like I said, it's not just focused on medicine being the only route of treatment. We use our hands, and it's served me pretty well when I worked in West Virginia, where I was serving like a lower socioeconomic community. A lot of patients weren't able to get the medications that they need. And that's kind of what led me to Milwaukee as well, where we're also helping serve like the underserved patient population. And it's been very humbling, I will say. And you kind of see some of the same issues that we were facing in West Virginia are also here as well. So
that is a tribute to, I think, just everything kind of compounding that's going on in the country, in our state. But knowing that everybody matters. So let me touch on the cultural side of this. One thing I absolutely love about the residency program is the global lens. Like, people are from different places, and I always mention this. I feel like medicine globally is so much more focused, right? Like, it's when you take someone not born and raised in the US and you talk about medicine, it's like a whole different face. It's like, this is what I was born to do, this is what I love to do. And so there's that passion that's there, which I love. So when you look at kind of the cultural lens of where everybody's from and how they decided to start medicine, and they're here, they bring that love and passion here. And I love that, because listen, you got to get people to care. Your doctor has to care about you. And I love that. So you can make an appointment with Dr. Tomar, 414-727-6320. Do you have some openings, Doc?
We do.
Okay.
Yeah. And like you said, we have doctors from all different cultures and different backgrounds. But we all come together under the same mission of helping to serve like the underserved patient population. So
how when you decided, like, you woke up, you're like, medicine is the thing.
Yeah.
Right. How old were you? What were you? Was it just always a passion?
So ever since I was little, I remember one of the shows, like when we were in kindergarten, we used to put on these performances and shows. So I remember one day I'm like, okay, I'm going to do this skit about being a doctor. So I pulled with my little Fisher Price doctor kit onto stage. Everything ended up falling onto the ground and picking up my stethoscope and doing this whole skit about treating one of my friends as like one of the patients. And it kind of evolved from there. On Halloweens, I was dressing up as like a surgeon at times.
Right.
So I feel like it's always been a part of me that I always wanted to help people. And that was the best way for me to give back to the local community.
That's, again, I love the passion of it. If I'm really honest, to have people who care, to have people that want to get to the root of issues, it's not the over medication, it's really tuning in and knowing that all the things. So you might be having headaches because you have hypertension, because you're not eating well. So here's the plan for that. It's not a medication fix, right? It's
lifestyle sometimes.
Lifestyle. It means getting in the gym, which I don't love. That's one thing I will do well, though. He will get in the gym. So when we talk about social determinants of health, right? So you mentioned briefly about the connections between Milwaukee and West Virginia. When we look at things like food security, when we look at things like housing, how does all that play a role in how people are healthy or not healthy?
Well, one of the things that we try to identify at our clinic right off the bat on your initial visit is looking at the social determinants of health.
Okay.
We have quite a large patient population that transportation is a barrier. So we try to work around it by asking those questions like that oftentimes are missed at other doctors' offices. So we start off the conversation with like, what are you able to even come to your appointment? And if we see that you're not having like those regular follow-ups, somebody will give you a call. We'll connect you with our social worker, or we'll figure out like, is their way to get the busing or like the cars to get you to your appointment. Just now, yesterday, we also started doing like home visits as well.
Love it.
Yes, I did my first home visit yesterday. That was really exciting. I got to meet the patient in their environment.
Listen, don't get me. I already said this is my lazy season. So I can get food to my door. I can get my groceries to my door. Don't tell me I can get my doctor to the door. I don't even have a reason to go outside anymore.
No.
That.
Well, we don't want that. We want you
walking treadmill. I got a little sunlight in the house. So what do you think is the value of having your physician being able to go into the home?
Like I said, it really taught me a lot about, what does the local environment look like? Like for some people, they can tell you, I'm having difficulties getting around my home, or you might have a patient that's falling down a lot, especially like the elderly. So you get to visualize like, are there stairs that could be dangerous for this patient? Are there elevators? And what happens in the case that there's like a fire or something? Can they get up and down those stairs safely?
So very true. So very true. And this is, so October is Health Literacy Month, and we chatted briefly about having these things that are easy to understand and easy to read. As you start to work with patients, continue to work with patients, when you have to advise for things like, your stairs, we probably have to reconsider that. We might have to reconsider diet. How do you make that easy to digest? No pun intended. No pun intended.
Well, it's all about breaking things down into something that's, everybody comes from like a different literacy level. So being able to break down the medication or the medical information that we're providing into language that the patient can't understand. And oftentimes it's about breaking it down into small pieces. So we might not be able to address, let's say, everything under the sun. But that's why I said follow-ups are so important. So maybe we'll talk about, hey, I don't think those stairs are like the best things. Let's get OT, which is the person that helps with like what are some of the issues that you're facing inside the home, involved, and see if there's a way we can address that for you.
And listen, if you do get a slide installed into the house, that's like my dream. That's my dream.
That is my dream too.
That's when I know I made it. Like from the 3rd floor to the emergency that's what I know I have truly made it. But making it easy to understand, easy to break down. I did a workshop in the Dells a couple weeks ago, and there was a full session on health literacy. And one of the things that made me think about this is most information that goes out should be at a 4th grade reading level.
Yes.
And I'm like, okay, what does that sound like? What does that look like? But just saying the thing, right?
Yeah.
Like just not sugarcoating it with a bunch of different words. How does that play with like my chart? So if my chart is the place where patients can look at the notes that are made by their physicians, they can leave questions. How does that piece of communication work with the notes that you might make?
It allows direct contact with the doctor itself. So it's not he said this, she said this, like coming from the triage line. It allows you to have a direct connection with your doctor. So let's say there's something in your note you don't understand. Like let's say I wrote the word dyspnea. You can ask your doctor. Yeah, what do you mean? Like I have dyspnea. Can you explain that to me? And I will be like, oh, that means like shortness of breath. I might write down how to take your medication in your note as well. And if there's something that you don't understand, like, hey, doctor, am I supposed to take 2 medications twice a day or 1 medication twice a day? You can get some clarity. And I think my chart is great because a lot of information, there's a lot of information out there on Google, like Dr. Google's a big thing in our communities. You can talk to your doctor directly and be like, hey, I searched this up. What do you think about that?
That's me. I was okay. I hate to say this, doc. I was on WebMD, and it's just the disappointment of like, you were on there, and now you've self-diagnosed all these things.
You have a runny nose and it's cancer.
I'm telling you, amputate. You gotta amputate. You gotta amputate. No matter what the issue is, but having those notes, having that direct communication. And one of the things I shared with listeners is that just ask. And so I'm hoping that's the right thing to say. If people don't understand, can they just ask?
Of course.
Okay. Can they ask twice and 3 times and just give it to me one more time? Right.
It's all about clarity. Like you said, everybody understands information a little bit differently. And it could be I didn't explain the information enough to you. So of course, come and ask all the questions that you have. But my chart also should not be used for like urgent things as well. So if it's something that's happening like at that moment, do not use my chart.
I like that. I like that. That's not the place to ask for the ambulance or anything.
No. Please just call the clinic or the hospital ED.
Yes, to make that happen. So I am in the studio with Dr. Rashna Tomar. We are talking health literacy. We are talking palliative care, the DO philosophy, and she is a physician with our family medicine residency program. And again, just the cultural competence, the care for medicine, all that is for me so very inspiring. Let me see. I think I'm due for a break, but the gentleman will let me know. So I'm gonna just keep pushing until they say, Ebony, stop talking.
Sure.
So let me ask, in terms of supporting families. So a lot of patients will come in by themselves. I had a conversation with a friend earlier this week, and I won't get into specifics, but sometimes it's just a lot of information coming out and you're like, whoa. So you just need somebody to go in with you that's listening for something different. Are families welcome to come in? So if mom's coming in, can she bring daughter? Can she bring son to kind of listen in to the conditions, maybe add to symptoms that aren't being shared? Can people bring family support when they come in?
Of course. And part of like doctor's visits can be scary. And I'm being honest, I also get scared going to a doctor's office. I probably one of those
to this day, I get a little the dentist too. I'm like, are you gonna take my teeth today? Like,
I think the dentist scares me more than the doctor. I'm not gonna lie.
I will say this. I have the bomb hygienist. She is phenomenal. So I make sure she is the one that touches my teeth each and every time.
Okay.
But yeah, it is scary. When they put that light on, I'm just like, did I floss enough? Did I get those back teeth enough?
The night before you're sitting there scrubbing your teeth, making sure you get every bit of spinach and stuff out of your teeth.
Listen, you'd be surprised. I do keep toothpicks everywhere. So I keep the little flossers.
Yeah.
Make it easy for yourself. And that goes back to the preventative care, right? If you know yourself, if you know what behaviors are difficult. I used to push back on the flossing. I'm like, who has time? But you buy those little flossers and you just get in there after every meal. Buy the little wisps, get in there. The same is true for your health. I love to eat. I've shared that. So when I read your bio, I'm like, yes, I love good food. So get up and walk afterwards, right? Just make a thing out of it. That's when I answer text, right? So are there maybe a few things you can share with us? And right out, I think I was on a break. So you tell me if I'm keep me honest. Yep. Keep me honest. So when we come back, I will ask you, Doc, how do we add those preventative care pieces into our daily routine, into our everyday that makes it easy for us, right? So look, he's like, get to your break. You are listening to Community Heartbeat, presented by Outreach Community Health Centers. I'm Ebony Ssali in the studio with Dr. Tomar. We'll be right back. Heartbeat presented by our Community Health Center, not just to show this is a movement to be healthier, dedicated to bringing our community together through wellness, keeping your heart pumping with positivity. We were talking about just being old, right? You just roll over and just stuff hurts.
Yeah.
I
Just
know.
stuff hurts. Just listen. The pillows on the bed, I have to sleep right because if I don't, then my neck is tight the whole day. We're talking about Mr. Arthritis.
Yeah. Me and Arthur had conversations anytime I come from the gym.
Look. But I will say this: being preventative with it, being in the gym. Who was here last time? Dr. Kaushik was here talking about how the x-rays, the data from a 60-year-old who's doing weight training and all that is totally different from somebody who is not, right? Like you need to be doing some kind of physical activity, some kind of heavy lifting. So I look at the differences between like 170-year-old they were out there at the marathon. I'm gonna tell you this, nothing slapped me harder than seeing, I think as she crossed the finish line, she was 76 or something like that. Marathon. 26.2 miles.
I don't think I could ever do that.
Do you see
I
what
can't
I'm saying?
visualize doing that.
I was like,
wow.
Goals.
Woo.
That's goals right there.
Even 13. So it was a half marathon too.
Yeah.
Listen, that's huge, right?
We had a patient this is a patient I remember from med school. He was in his hundreds actually. And he had gotten like an EKG, and the EKG looked so good. It was equivalent to somebody that was a lot younger than him. And when we asked him what he does, he's a farmer. He's always out there in the fields, tending. Yep.
Yeah. So that for me was inspiration. I'm like, all right, Ebony, you might not be able to order cheese on that. You might have to slow it down this week and just being physical. So to the 76-year-old marathoner out there, salute to you, because that was it. So the preventative care, this is where I was going. I was off on a tangent. The preventative care, the taking care of yourself in the long run is also cheaper, right? Would you say? Okay.
It definitely is. That's been the recent movement, all about like preventative care. Like how can we prevent major diseases from progressing to the point where people are going into the hospital frequently because they're having COPD exacerbations or their sugars are not controlled. Preventing it from developing into full-blown diabetes.
Yes. So, okay, since we got our doctor here.
Yes.
Pre-diabetes.
Yes.
Talk to me about what is it? Is that real? Is pre-diabetes real? And what are some of the red flags that say you're heading to danger?
So pre-diabetes is all about, there's a certain numbers that we look at. So we look at your A1C. That measures your sugars in the past 3 months.
Okay.
So it's in that danger zone, we will call it. So like between 5.7 to 6.4.
Okay.
That's the number where we're like, okay, let's talk about what's going on. What does your diet look like? Are you exercising? And you were talking about weightlifting. Weightlifting is actually a great way to lose weight as well.
Yes.
And a lot of
I'm getting back on it, I promise.
Oh, really? That's
not
more
today,
than me.
but I will be.
Again, that's more than me. I try to incorporate it here and there, but then I get tired.
Yeah. It's a lot. It's a lot. But I want to be swole too, like right out. Get my muscles together. I'm working on it. So preventative care, getting your regular checkups. So I always ask this question. Someone is nervous. They're at home. They're like, I know what I should be doing. They call to make an appointment, 414-727-6320. They come in for that first appointment. What should they expect?
The first thing that they should expect is a doctor that's gonna, like I said before, that's gonna ask you what is most important to you. So if you're going in for a preventative visit, you might not know the things to ask for per se, but we will lead you there. There's certain guidelines that we follow that all clinics across the country follow, and we'll look at those. Like, should we check, like, do you have a family history of like cancer, cholesterol being an issue, diabetes? What does your weight look like? What does your lifestyle look like? So we'll ask those questions to direct the care. And then we'll get certain labs and imaging if needed to help us better understand you and how your body is doing.
No, that makes total, and you will keep it real, right? So there's the part that I always say, nobody wants to be told they need to eat broccoli. We don't want to hear the green leaf, right?
No.
Right? But putting some good seasonings that aren't high in sodium is the way to go. So you will tell us that we need to. Broccoli is always better than candy, right? Okay. Or are you gonna be the doctor that says that?
I'm gonna be real. There's no way I'm getting through without having candy here and there.
This is fair.
It's being realistic. I feel like it's not about taking things away. So if you like candy, have it, but it's all about moderation.
Because the cheesecake is happening after the
I
meal.
know.
It's happening. It is happening.
Oh my gosh, now I want cheesecake.
But I will say, going down that preventative care, going down the things that are better for us, it's the swapping for things that make sense. So take some chocolate pudding, throw some Oreo cookie on top of that. That tastes kind of like cheesecake. This is what I tell myself. So making those good swaps of things that are healthy for you, as we were saying, is cheaper because heart surgery is not inexpensive, would you say?
No, definitely is not. Yes. And it comes with, you have to train the heart afterwards as well. So you're going to be in rehabilitation afterwards. But we also have a great nutritionist at the Outreach Clinic as well. I got to spend some time with her and I'm like, oh, I didn't know peanuts were carbohydrates. So she teaches you a lot. So that's one of the resources that we have available that, helps us and like even the patients learn a little bit more about what am I eating.
That can either like food is medicine. So this the thought process that food is medicine. I will say just small swaps. The cabbage, I've been on this cabbage kick. And if you can go to WebMD and look up all these symptoms, you can also go and find some healthy recipes and you can pull those down.
You know how I wrote about or you talked about how I love like diverse dishes. That was something that I explored. Like there's a Russian dish for cabbage. I think I have to send it to you now.
I did. Listen, this past week I did 2 recipes. There's one online that's like melting Parmesan cabbage. Listen, oh my God. It was everything and more. So it got me to eat almost a whole head of cabbage for dinner.
Wow.
And then the next was the fried with just a little oil and the Creole seasoning, peppers and all that. So a vegetarian dish. Again, better for the heart. In my spirit, I wanted a big burger. I did have that too this week.
That's fine.
It's the small swaps, right?
As long as you're not having burgers, let's say every single day. And sometimes even swapping out like the beef patties for like turkey. Air frying it, maybe, see how that works for you.
She's like, just get it in there.
Like I said, it's about being realistic. You can't stay away from a burger all the time. If that's something
with blue cheese.
Oh, okay.
With the garlic Parmesan.
Oh my God. It's too early.
Okay, you're right. I'm already thinking for lunch.
Okay.
No. With cheesecake for dessert.
Oh my gosh. Okay, maybe that will be my meal for today.
And that way you could just hibernate till tomorrow because it
is the weekend. And it's raining.
Listen, a good chili, okay. That's a different show. We did mention just briefly that we are doing our Dine with Docs in 2026, which is an event that we have doctors come to Benihana and they cook for us, right? So that's it. It's a smash event. We are having it again. So mark your calendar. March 18th is the Dine with Docs 2026, and it is going to be a time. So I hope we can get you on the grill.
Oh, I would love to. I missed it last year. I know Dr. Kashik, who was here last time, was part of it.
Yes, so good. And space is limited. So let me say, Milwaukee, if you are listening, when you see it go up, there's only maybe 60 or 70 spots that we have for this event, and it is an absolute time. So make sure you mark your calendar. Be there or be square, as the people say. Good food, healthy food. And just a fun time to hang out with our doctors. So open enrollment starts soon. Let me just put a plug in for that. So if you don't know what this government is going to do, which we really don't, come in and talk with our professionals there. Let me ask you, Doc, there's a component of, we talked about the fitness, we talked about the preventative care, rest. Yes. How important is rest in this thing? Because I think I'm part of the rest ministry across all denominations. I believe sleep is the key. Sleep is the key. But what are your thoughts about rest?
one thing I learned about this community with my time here is we have such hardworking people.
Yes.
I had now I'm thinking about a patient that I saw recently. I'm not going to mention the name, but she was talking about how much her shoulder hurts, but her job requires her to be lifting packages all the time. But she was not willing to give that up. And I'm like, you have to let your body rest to allow you to do the job that you like doing.
Yeah.
Get your hours of sleep that you need.
And I will say, even the small things, some folks have commented, they'll bring over my purse or bring over my work bag, and they're like, my God, this is heavy, and you carry this. I don't even think twice about it, because everything that's in there I got to take with me. But the small things of letting your body rest. So talk to us about sleep. How much sleep should we be getting?
It depends on the person, actually.
Okay.
Yeah, it differs from person to person.
Okay.
It's all about having that restorative sleep. So if you're waking up tired in the morning, we talk you let your doctor know, and we can talk about, is sleep apnea possibly something that you could be suffering from. So if you have a partner that's snoring, that's one of the things that we look at.
Listen, not on my watch. Not on my watch.
So question with snoring. Now I know that for some people, well, let me use me. I had surgery, and I had my adenoids removed.
What's the adenoid?
It's
Y'all
inside
deep in the anatomy and physiology.
Yeah.
Okay.
So I had those removed, and then I had surgery on my deviated
septum. Yeah.
Right. That was one of the worst surgeries ever.
Oh, I heard it hurts. Yeah.
Not only that, but they put a cast. So you.
The afterwards.
Are there pictures of this thing? Are there pictures that I could use?
Oh, you talking about stuffaluffagus?
Oh, wow.
Yes.
Jesus.
A cast in your nose.
Yes, it's the worst. But that helped me a lot, because I used to snore, but my snoring was because I picked up weight over the time. So I was almost 300 pounds, just sitting around eating and doing stupid stuff, and picked up weight and didn't realize it. And that was the cause of me having sleep apnea. Now, they told me after they gave me the machine, I went and had the machine. So they told me either you can sleep with the machine or you can lose the weight. I tried the machine, and the machine is like going on the freeway 90 miles an hour, roll your window down, stick your head out, and open your mouth. So all of that pressure that's coming in.
That's oddly specific, right out.
Yeah. So it's like all that pressure that's coming in from the CPAP.
Yeah.
So I decided, I was like, nah, man, I'm going to go lose the weight. I don't want to live like that. And when I started that journey, I noticed, man, that my sleep apnea went away.
Great.
Because it was terrible. Like, I'll be sitting and I'll talk to you, then I'll fall asleep. And come to find out that I would stop breathing in an 8-hour period 450 something times.
Yeah. And that's your brain not getting.
Yeah, that's real scary. So they told me I was in heart attack, stroke range, because my oxygen level will drop to 60 and below.
Yep.
We can do this the easy way right out.
And that's why I decided, man, I'm gonna put down the triple cheeseburgers with bacon and mayonnaise and all of the other stuff I was eating just crazy. Ribs and all of that stuff, just eating late. And not realizing that it was catching up to me.
But I'm glad that worked for you.
Yeah.
But that's why I'm saying it's very important to have that conversation with the doctors, because sometimes it's not about your weight. It's about your anatomy.
Yeah.
So then that's where we get like the sleep specialist in and be like, is this fixable by losing the weight, or is this more, because my dad snores too, but he's of a lower BMI. My dad's snoring. I remember one time we were having a sleepover downstairs and my friends were scared, and he's not a big guy. He never was, but it's part of his anatomy. So he went to go talk to his doctor, had that conversation, and weight loss really wouldn't have helped him in that situation.
So what about the whole balloon thing? Because they do that procedure now, when they put the balloon and open up your airway to help you from snoring. I think Advent does it. It's a procedure now.
Company.
Yeah, that they do. It's called the balloon technique, and they would put it up there, but they would put air in it that would expand the balloon, that would open up your passages.
Leave my passages alone. That sounds like, and then it just no. I'm gonna veto that procedure. This is Ebony, the love doctor. I am vetoing that procedure.
Yeah. Well, I mean, I know that I actually thought about it at first, because even like with my sinuses, I get clogged real bad and things like that. Yeah. So just opening up the airwaves, I know that would help me a lot.
I know something that'll help, but we'll talk about that
there
during
you go.
The final break, because the lung health and all of that is important. So I'm gonna keep yelling at you right out until I get you
from a distance.
It's because I care. It's because I want you to be well. I want you to be healthy. I want you to be all that you can be.
And you know what? And I really believe that, because I see you being all that you can be, and you lead by example.
Wait till I get in this gym for real. Just wait until I do that. But the preventative.
Am I gonna see you running a marathon?
Listen. Running long distances have never been my thing, right? So I am like a cheetah. You're gonna get full speed, but it's gonna be like 9 seconds.
9 second of burst.
Well, let's get it to 15.
Right? No, it's funny. I mean, listen, the inner dialogue that I have with myself when I take off to run, I try to dress super cute, get in the mindset, but 2 blocks in, it's like, oh, so you want us to die today? Is that what we're doing? We're stopping right now. So however you want it, we could do it easy way, the hard way. We'll just take your legs to run to you if need be. So I don't think the running is my spirit, but the weightlifting I can get to.
Okay.
I do like to walk though.
I used to. I haven't done it in a while.
Oh, we don't.
Wow.
Be kind.
I just said we don't.
Be kind.
I used to go to Marshall High School.
Yeah, and that's the thing.
The track.
Find you a neighborhood track.
Mm-hmm.
Get into it. For a while, I was at Brown Deer on the stairs. And so we used to have a thing back in the day where you had to be up and down the large bleachers in 1 minute, or you had to do it do it again. Now that's real easy when you like 17, 18. Yeah. You're like, please, with 15 seconds to spare. Now I'm like 1 minute and 7 seconds. I can do it. Do it again.
I know. So, seeing my mile time go up from when I was younger. I did track too when I was younger. And now to what it is, I'm like, what happened? Why can't I run anymore?
You just gave up.
Yeah. No, so make it a habit to bring it full circle. If you love to eat, which I do, we share recipes. Go for a walk.
What are seniors doing now with the demise, if you will, of a lot of the indoor malls where they used to go and walk?
Going to the bay shores.
Yeah. I feel like some of them are still out there, but just walk in the neighborhood.
Some of them are at the YMCA too.
Now I see a lot of them.
Aerobics.
I see a lot of them at the lake. I go down to the lake.
Yes.
I see a lot of walking back and forth and things like that. So
I give you credit though, man. You certainly stay with it to no avail, but you certainly.
Y'all are a mess. Y'all are a mess here.
This is why I get over.
Well, I have to shoot my shot too, right? I mean,
Fair. See, that's fair. Now y'all even. Now hug it out. No,
great regimen, but it's
See.
No, every little bit helps. Every little bit counts. So no wasted workout, I think is the concept now.
Yeah. If you talk to your doctor, they're going to tell you 150 minutes of intense exercise per week.
Intense.
Yeah. So that's not to the point where you're passing out, though. It's more so like you're having a difficulty having like a conversation. Yeah. You're not on your phone walking around, but not everybody can get to that right away. So even 5 minutes, if you can get up from your chair and walk around while taking like a phone call or something, that can help too.
Debo, that don't include lifting your fork up and down to your mouth. That don't include that, brother.
See, they laughing all in the studio.
Lord have mercy. Just walking past, if you're using a smartwatch, if you're using your phone, it will remind you. Like there are some days where I'm just so ensconced in my work that I just forget to get up. So having that vibration, like, hey, get up and take a walk.
Yeah, that's one of the features I love about my smartwatch. It's like, hey, time to get moving.
Yes.
You know, like he don't pay attention to it. And people look at his watch and be like, no.
Who knows that?
I do. Not now.
What's going on with my alarm? There's an alarm going.
To be fair, sometimes it'll be like, oh, time to stand up. I'm like, I'm in the middle of a meeting. How do you want me to get up?
You know what? Say my watch has stayed.
Time for me to
time to woo side.
do a couple squats right there in the meeting, and then that'll keep your meeting short.
Yeah. What's wrong with her?
You gotta meet with the weirdo again. Yeah.
What is she doing?
No, we did a chair yoga session at our last all staff community meeting.
What does that look like? Could you show us?
I won't. No.
Do you have an Apple Watch right now?
I have a Samsung.
Oh, okay. What is it
Chair
called?
yoga?
Yeah.
Listen, chair yoga is a move, but the thing is, like, when you sit hunched over a desk all day, like, you forget to like sit up and do your thing, right?
Right.
So I tell people, if you walk past my office and I'm like in the compromising position, just keep it moving. I'm trying to stretch, just peek in the window. No, I don't know what she in there doing, but keep it moving because I'm trying to keep things loosened.
I mean, so what do you do? Is it like
that's
rolling
a different
your shoulders?
That's a different show. But just know that my office is cracking. That's like,
My office hours are
9 a.m.
to 5.
No, but health is wealth. Health is good for all of us. So I'm glad we could add some levity to it. Dr. Tomar, thank you so much for joining us today. Hopefully it was fun. You shared a lot of great knowledge. Come and see her, 414-727-6320. Another episode in the books right out. As always, thank you. We're going to keep working. Keep praying, saints.
Keep me in your prayers.
Saints and ain'ts. Keep it up.
Now you got somebody else to bug you. Like,
Right.
Exactly.
Now I got 2
Hey, and to our caller, our sister who called in, we can make this every 2 weeks. She could just stay on me. Debo, thank you so much for all of your fantastic work. Listen, we'll see you back here in 2 weeks. We will talk dental. We will talk breast cancer. We will talk health literacy. You are listening to Community Heartbeat, presented by Outreach Community Health Centers. Not just a show. This is a movement dedicated to bringing our community together through wellness, keeping your heart pumping with positivity. I am Ebony Ssali, and I'll see you back in 2 weeks.